Hi, Kinesiology 4120, Strength and Conditioning. This week we're going to go through flexibility and mobility. Yeah, they're slightly different, they're kind of similar. We'll go through them, talk about how to plan for them, how to integrate them into your training programs, and why one may be more specific, one less specific, depending on what you're doing for your sport-specific project. You may want to integrate some flexibility and mobility aspects depending on the athlete that you plan to use for that project. Okay, so when we talk about flexibility and mobility, flexibility is the range of motion available at a joint. We can use this looking at it statically, also dynamically. So flexibility, static flexibility is the range of motion that you can achieve at a joint, that end range of motion specific to the plane of motion and the movement pattern specifically at that joint. Dynamic range of motion or dynamic flexibility talks about our movement, the ability to get into that position, not the position that is possible, but where we can actively put ourselves into. Think of it as more like active range of motion, dynamic, compared to static range of motion, which we could have some other force putting us into that position. So static flexibility, range of motion possible during passive movement. So no muscle forces, no external forces. We're just putting ourselves into that end range and often having some external force placed on us to get us into further range of motion passively. So we're not working actively to push ourselves into that position. You can use something like a band, you can use a partner, you can use something like a box, something like the floor. Gravity is a great one. Other weights or resistance to push you into that position, load you into that position to create more end range of motion passively. You may need this in athletes that require their bodies to be put in awkward positions. Think about football players who are tackled. They need to have quite a bit of static flexibility or range of motion possible without injury, because often injury comes when we are placing our joints at further range of motion than is available in that plane. So range of motion is extremely important, especially for contact-based sports. Dynamic flexibility, or what we'll term as mobility, will be dynamic flexibility. It's the same thing. It's the available range of motion that we can move through. This has more transfer specifically to sport because often we're not just being pushed into some strange position, but we have to create tension and create control and stability and force at that end range of motion or within that range of motion, or we have to put our body physically into that position at an end range or near end range of motion. Depending on the sport, depending on the needs, this is very joint specific. So it's not looking at the entire system. There's no holistic flexibility assessment. It's specific to each joint and the requirements are specific to each joint. Some different factors affect this, some things that we need to pay attention to as coaches. What factors are contributing to that flexibility or inflexibility or mobility or lack of mobility? Because it could just be joint structure. Everybody is structured slightly different. We don't all look like an anatomy textbook. So joint structure may be the culprit, may not be allowing range of motion. Age, younger individuals have higher range of motion than older individuals. Range of motion also is lost during age through joint degradation and things like that. Sex may play an issue or may play a role. Females often have greater elastic properties within their connective tissue, which may lead to greater range of motion, both statically and dynamically. If someone's connective tissue is extremely stiff and robust, they may have a lack of range of motion, may not allow them to move through a greater range of motion. This can be good and bad. There can be very specific range of motion that's required, and more range of motion can also be detrimental. So it's more optimal range of motion rather than maximal range of motion. Muscle bulk may play a role. If an individual has more muscle mass, it may limit the availability of motion at some joints. Physical activity level is a huge one. The more physical activity you perform, the more range of motion, especially if you perform more activity through the same range of motion. So your body will only adapt to the range of motion that you train within or move within, especially if there is neurological control and load or resistance involved in that range of motion. If you're gaining range of motion or you're stretching, you have more static flexibility, but you never load that tissue in that range of motion, you'll never maximally achieve that range of motion from a dynamic standpoint. There's also some people that say resistance training will make you muscle bound and will decrease your range of motion. Weightlifters are some of the most flexible individuals. However, all they do is resistance train. That's their job. That's their sport, is lifting weights. So resistance training can actually be a tool to increase range of motion because that load applied through the range of motion creates stability and control. Training resistance training through a full available range of motion will build and develop a full range of motion. Training within a shortened range of motion will build and develop a shortened range of motion. So you can see a powerlifter on the screen. A powerlifter only needs a very specific, limited amount of range of motion when it comes to something like a dynamic movement like the squat. They only require their hip crease to be able to go just below knee joint level, or a parallel squat. Any more than that can cause instability at that same point. So it's more tuned range of motion. They don't want to be able to have a lot of motion at their spine because they need a very stable structure there. So it may be a required optimal amount of range of motion rather than optimal range or maximal range of motion available, which you may see in someone who performs something like yoga, where they need maximal range of motion in all joints. When it comes to programming and planning for range of motion flexibility, we need at least about 2 times per week for 5 weeks to see lasting benefits. So just stretching once is not going to cause any real change. And it must be pushed to the end range of motion with force to cause change. Tissues require some kind of stimulus that is beyond normal to cause an adaptation. Flexibility and range of motion is the same way. Okay, we need to force end range position and force contraction and neurological control within that range of motion. So just doing kind of touching your toes passively isn't really going to give you much additional range of motion. But pushing your body to an end range of motion, here you see a pec stretch or a hip extensor stretch, putting yourself into that with some kind of load, like maybe a band, another force, another person, and creating contracting and relaxing activities and forcing active control there will create a lasting change and cause lasting benefits. So we need to apply force at that end range to cause change. So when do we do this? When can we program in stretching and flexibility into our training program with our athlete? Dynamic stretching is best done during a warm-up because it progressively increases the active controllable range of motion available at that session. So dynamic stretching within the range of motion required for the activity for that training session or that practice session is best done during that warm-up session. Static stretching is best done post because it causes a relaxation of the nervous system and causes us to go into a more parasympathetic state and can help ingrain that range of motion that we tried to establish within our training session or our practice session. Or we can do any kind of stretching after a warm-up as a separate individual training session. So it may be a recovery, it may be an in-between training session, often like a restoration style training session where you perform some kind of warm-up activity, maybe a cardiovascular warm-up, some kind of warm-up, and then you engage in some kind of active, dynamic, and passive static stretching activities to help ingrain more range of motion required for your athlete for their sport. I recommend this be programmed especially in your postseason blocks when you're trying to regain range of motion that they may have lost during a competitive season, and throughout as restoration pieces throughout heavy, intense training cycles, like your off-season or your preseason cycles where those volumes and intensities are a little bit higher than normals. Adding in some restoration and range of motion modalities can help in eliciting a positive recovery standpoint and improving the available range of motion they have so that they can train through the range of motion they need for their sport. Some of the science behind how that stretching actually works. We know we have muscle spindles. You've talked about them in exercise physiology, probably applied kinesiology. Muscle spindles sense stretch and rate of stretch. We talked about them with plyometrics as how they can help us have a more reflexive, higher velocity, higher forceful contraction in our muscles after we stretch in some kind of plyometric high velocity activity. We can also cause an inhibition and a relaxation with the muscle spindles through extended stretch for long periods of time, especially somewhere around 15 to 30 seconds, can cause a inhibition of the stretch reflex, which is often why we don't want to do static stretching before ballistic activities, because we are decreasing or inhibiting our reflexive responses. But with that, we can allow an acute increase in range of motion by decreasing the tonic muscle activity from that stretching. We can also get things like reciprocal inhibition, which is kind of that contract relax. But with our GTOs or our Golgi tendon organs, they can cause a reflexive relaxation through an increased load on that tissue. When we do some kind of contract and relax, we can get autogenic inhibition, where we contract a muscle and then relax that muscle, which will allow us to increase the stretch on the muscle that was previously contracted. It'll allow a reflexive relaxation or inhibition of muscle activity. And reciprocal inhibition is where we contract an agonist to allow a stretch of the antagonist. So we did a little bit of this when we did our hip stretches, where we would contract the glute to stretch the hip flexors. So contracting the extensors causes a reciprocal inhibition of the flexors. Contracting the flexors causes a reciprocal inhibition of the extensors, and so on with those agonist-antagonist muscle groups. So we can trick the nervous system or play with the nervous system to increase range of motion, but we have to do this over the long term with applied force and with some kind of major stimulus beyond what the body normally feels to create lasting change, because this is really short-term acute changes that are tricking the nervous system into relaxing the muscle so it can be more extensible. If we want long-term range of motion changes, we have to do long duration training programs that incorporate this same stretch with more load and with more intensity. So some other types of stretching that we may add in, static stretching, we know best alone or at the end of training. Ballistic stretching, I would only recommend these in advanced athletes that are high velocity sport athletes. This actually causes a stretch reflex and causes a tuning or kind of a tuning of the reflexive muscle spindles by fast, rapid movements, things like leg swings, kind of tune or turn on the nervous system to be a little bit more sensitive to high stretching activities, because it turns on that pathway and now we're ready to see it again. I would only recommend this in advanced athletes, not in beginning athletes. And then dynamic stretchings, these can be things like our dynamic warm-ups that we do, mobility drills where we are putting ourselves in a range of motion actively and then taking ourselves out of it and doing it over and over again to build that range of motion before a training session. Okay, I recommend these as warm-ups and pushing those warm-ups a little bit harder and harder and harder as you go in the training, because you're going to warm up before every session. That gives you a greater exposure to these drills because they're exposed to them every single training session. They will be able to achieve a greater range of motion than if they were done once or twice a week. So the key ones that you really want, add them in the warm-up so that you see a greater exposure to that exercise or that drill. When we want to control the nervous system, we talked about reflexive or reciprocal inhibition, autogenic inhibition. We can implore those into our training through things like proprioceptive neuromuscular facilitation. So this is a stretching modality that will trick the nervous system into allowing acute increases in range of motion. So we take advantage of this relax, contract, relax, contract. So you would relax into a passive stretch, and then you would contract against that force that put you into that stretch, and then relax. That contract and then relax allows autogenic inhibition, so that previously contracted muscle relaxes and allows more stretch, and then you contract the agonist or the opposing muscle group to stretch that antagonist. So if you're stretching your hamstrings, as you see in this image, you would relax into a passive stretch, contract the hip extensors of the hamstrings against that resistance, and then relax again. They would put you into a greater passive stretch, and then you would contract the hip flexors or the quadriceps and the hip flexors together to cause some more reciprocal inhibition of the hamstrings to increase that stretch even more. Engaging this a couple times will allow a acute range of motion advantage. So now the hamstrings will have a greater elasticity, a greater range of motion available for a short period of time. This often lasts somewhere around 2 hours at most to create this kind of, I call it a nervous system trick to allow more range of motion. It's not going to stay forever. It's not a chronic change, but it's an acute change that you may be able to use in training. And if you use it in training, it's more likely to stick long-term because you're training it under load and you're training nervous system control of the musculature in new ranges of motion. So this may be something to integrate prior to training, but often at a lighter training session. Last one that's becoming a little bit more popular is self-myofascial release as a way of increasing mobility. Research does show that self-myofascial release, or foam rolling, it's self-massage using another implement, actually increases range of motion acutely, similar to that done with static stretching. So there are some benefits, and there's no change in the nervous system that tells you, or it doesn't increase the relaxation of the muscle spindles similar to static stretching. It may take, there's some thought that it does take advantage of GTO reflexive relaxation by creating tension through the muscle belly and causing a reflexive relaxation. It also increases blood flow to the muscle, which may be good in a warm-up scenario. So foam rolling may be, or myofascial release, self-myofascial release may be a better warm-up tool than static stretching in many cases. And it may help also with reflexive relaxation post-training or during a recovery training session to allow restoration, because there's an increase in blood flow and that reflexive relaxation. Some people do see it as a way to decrease soreness of the musculature. It's often from probably the increase in blood flow, and the reflexive relaxation may reduce that soreness. It may kind of calm the nervous system and allow more blood flow and restoration for the tissue. So it's a great way for you to add some range of motion and allow some recovery. So I'd recommend this as either as a warm-up or a cool-down activity, and can be used kind of interchangeably with static stretching to improve range of motion at a specific joint at a specific time. Long-term use of all of these modalities is great. Just periodize them throughout your training program to elicit the best response. All right, thank you very much. Thank you for watching. Go through on Blackboard and take your online quiz when it comes to mobility and flexibility. If you have future questions, please ask in our individual or in our group reviews that I'll have posted for this week. All right, thank you very much.